Good morning, friends. Today we are going to talk about sleep, the importance of sleep, and problems associated with sleep in day to day. Actually, it is not meant for doctors because sleep disordered breathing is a entirely different topic. I am going to tell only few. I'll answer some of your questions that commonly asked to me. If I say that one third of our life is spent on sleep, we'll be really get astonished, and that is what the fact. Sleep is a vital process because whatever the energy we spent on the day, it is get recovered back during sleep. I already said it's a vital process and it goes in a circadian rhythm. I think I'll talk about the circadian rhythm little later, and probably circadian rhythm means see the day and night like that. Sleep and wake always occurs as a circadian rhythm. During sleep, our health, particularly the body health, mental health, all becomes very robust. That's what I can say. The usual question asked to me by the parents are sometimes they bring the newborn. Doctor, this is our cute little angel, but he sleeps 24 hours, doctor. Is it any abnormal? No. It is newborn can sleep even up to 18 hours. That is what the study says that. So you have to enjoy. Sometimes during sleep, it have a nice smile. Actually, in newborn, it reacts everything in the form of smile. You have to enjoy that. So it is not an abnormal process. It is a normal one. Second question usually asked to me is, doctor, this boy is around 7 8 months old. He makes a lot of noise, doctor. Before sleep, everybody knows he is making some throaty sounds, some moaning. Sometimes he sings a song like thing. I don't know, I have not seen in some babies. This is peculiar to me. That is a question. I think it's a very normal. Those days, mother, they used to sing lullaby, talat. But nowadays it's a busy world and lullaby is not there. Only some people may practice. And that is the reason why children themselves started doing or singing lullaby for their comfort. I think you have to enjoy. So lullaby or throaty sounds, these throaty sounds are equal to lullaby. You have to enjoy it. It's not an abnormal process. The usual question nowadays is that doctor, he plays 24 hours with a smartphone. Even during his sleep, he wants that. Without that, he is not able to sleep. How to get away from that? Actually, this is a man-made problem. It is not. It is made by us. See, you are always practicing using the smartphone to pacify him. That should not be. That is the reason some educated parents, they are very cautious nowadays. Even from the newborn period, they never show the smartphone for and only when the child reaches around 2 or 3 years only they will allow you to see. If you started to use smartphone or if you use as a pacifier, this may be a problem. But I want to give one solution also. Some children were addicted for that problem, that is seeing a smartphone before sleep. You can change it by getting lot of toys. You can bring lot of toys like that. See, it's a nice, a cute one. See, something like that. So all these toys will make them to think something, and so slowly you can snatch the smartphone. But if it is a older child, okay, older child, you can give nice books like these books, and some children will love to read all these books and all, okay. And this is another type of picture book. All these books you can purchase now. A lot of books are available, and you can purchase. You can keep it with you. You can change. In that way, you can reduce the screen time. The last one important question is snoring. Doctor, my child snores a lot. It's not only your child. Actually, 20 to 25% of the adult, or I can say 5 to 10% of the children are habitual snorers. Actually, this is not a abnormal one. Actually, they make a big sound. That is why it is a healthy sleep. I can say that. That is why sometimes it is called sound sleep. Did you have sound sleep? Something like that they ask. Okay, so it is a sound sleep, but as long it is a very good for them. Only the people very close to them will disturb. Actually, those days when I go for the conferences, nobody wants to sleep with my room because I make a big snorer those days. But of late, after reducing my weight, my snoring also come down. And but one thing I want to say that there is a different type of snoring that is called what I called sleep apnea related snoring. Some people not only snores loudly, but their entire sleep get disturbed. The sleep cycle will be fragmented. Every hour or every 30 minutes, they can wake up. What happened means, in these people, because of the laxity of the throat muscles, the airway gets closed. So the air is not going. When the air is not going, he is going to hypoxia. So it stimulates the brain, ask him to get up, you are doing. So that is the way they get up from the sleep with a gasping respiration. Actually, that is called sleep apnea. In children, it may be due to some obstructive causes also. Over the age, there are a lot of causes. I don't want to discuss the entire sleep apnea here. But anybody see their children not only snores, but also sleep get fragmented. He repeatedly gets up, arousal, awakenings. These are all more during sleep. Or sometimes they drench because of that sympathetic drive. They actually during hypoxia, there is adrenaline secretion. They will become sweaty and they will get up from the sleep with arousal, with the gasping respiration and all. That should be that. You have to note that one. You have to actually nowadays you can make video that one and you will show to the doctor. Is it abnormal? Then the doctor do some investigation like polysomnography and they will find if it is found to be very abnormal, they will treat it. Why I am telling is sleep apnea is a problem. Nowadays it is increasing. So you have to detect at the early age. If you detect at the early age, you can avoid the complications, particularly the complications related to heart, complications related to the brain. All these things can be avoided. This is a very, very important message I want to think. So far, I have discussed some of the common questions asked by the parents. Finally, I want to say that sleep is a very, very important process. What WHO says, children should have at least 8 to 9 hours, okay? And adults should have at least 7 to 8 hours. Actually, how to get a quality sleep, this is very, very important. Actually, sleep, you cannot buy the sleep. See, our environment should be very cozy. See, I always sleep in my room. It should not have any gadgets. I cannot keep any smartphone or anything with me. Or even I may not have the ticking clock. It should not be loaded with any articles. It should be very, very neat and tidy. And once you go for your bed, there should be a very dim light and the environment, you should not get disturbed by others. This is for others also. When child goes for sleep, if you make a lot of noise, then the child will get up. Okay. So if you want to get a quality sleep, there should not be any interruption in the form of light, interruption in the form of sound. These are all very important. Once a child had a quality sleep of at least 8 hours, I think, or 9 hours, he will have a very, very healthy life. He will do much better performance in the school. That's what I can say that. So I talked something about the sleep. Next time we'll discuss some other important topic. Thank you.